Hello, I'm Dr. Waldron, and I want to talk today about what is an acquired brain injury. I want to talk about the different types of injury that people can have that constitute an ABI, or acquired brain injury. An ABI is effectively a one-off acute onset injury that occurs, that damages a person's brain, which is not by chronic onset and is not expected to deteriorate or get worse over time. Generally, people fall under one of these main category headings. So there'd be traumatic brain injury, a CVA or stroke, encephalitis and meningitis, the infections, anoxia, lack of oxygen to the brain, or people who've had brain tumours. So for traumatic brain injury being the first one to look at, it's a sudden onset damage to the head that's caused by an external force. Generally the head is involved in some kind of an impact, so your head hits off something or something hits off your head. The common causes would be car crashes, falls and assaults. Normally the brain is very well protected inside the skull. You've got protection from your skin, from the bone of your skull, from the muscles, and from layers inside your skull called meninges, just above the surface of your brain. And those layers are bathed in something called cerebrospinal fluid, and all of those things can act as a cushion to the force of an impact. However, when higher force impacts occur, they can overwhelm those protective factors and lead to damage to your brain. There can be damage at the site of the impact, and then there's often damage on the far side of your brain, which is caused by your brain moving within your skull with the impact. And that's called a counter-coup injury. And also, if there's a rotational force, that can sometimes damage the long white matter fibers inside your brain, which is an additional source of damage people get sometimes in traumatic brain injury. So traumatic brain injury is often categorized as either being mild or moderate or severe. And that's based on factors like the length of time somebody is unconscious, or the length of time that people are in post-traumatic amnesia, which is the period of time after an injury where people can't make new memories and they're disoriented. So a mild TBI is associated with unconsciousness of less than 30 minutes and a post-traumatic amnesia of less than a day. A moderate traumatic brain injury is unconsciousness of about 30 minutes to 24 hours and a PTA of between 1 and 7 days. And then a severe traumatic brain injury is unconsciousness of more than 24 hours and PTA of more than 7 days. In addition then, the Glasgow Coma Scale, or GCS, is often used as an index of how severe an injury is, and it measures the extent that people are able to open their eyes, produce a sensible verbal response, and to provide a motor response, such as moving your arm to command. Now, to talk about stroke. So your brain requires a number of things to operate normally, and these include a supply of oxygen and a supply of glucose. And the oxygen and the glucose are normally provided to your brain via the four main arteries that supply the brain. And inside your brain is a complex network of veins and arteries that branch out and spread and supply oxygen and glucose to all of your different brain areas. And a CVA, or cerebral vascular accident, or more commonly called a stroke, is effectively where there's a problem with that blood supply reaching some part of your brain for whatever reason. If it's starved of oxygen and glucose, that part of your brain can then start to die off. And this can happen in a few different circumstances. So there's three main types of stroke that would be recognized, and the first of which is an ischemic stroke. An ischemic stroke occurs when there's a clot or a blockage in one of the blood vessels, and this prevents proper blood flow to all of the regions in your brain. If it's detected very quickly, people can be admitted to hospital and can have an injection of medication that can break down that clot. The second type is an intracerebral hemorrhage. So this is where there's a bleed, this time inside in the substance of your brain. It occurs when the blood vessel bursts, and blood can now escape into the surrounding tissue. So obviously oxygen and glucose now aren't reaching points downstream from that break in the vessel, and instead blood is escaping into the substance of your brain. The third type of stroke is a subarachnoid hemorrhage, and this occurs when a blood vessel on the surface of your brain becomes damaged and bleeds into the area that's beneath your skull. And it's also of note here, for those two hemorrhagic strokes, the intracerebral hemorrhage and the subarachnoid hemorrhage, normally your brain tissue is not in contact with blood, it's contained inside the arteries and the veins. And when there is a bleed, the blood itself can cause additional damage to the brain cells. So to think about brain infections, and there's two main types to look at, and that would be meningitis and encephalitis. In the case of meningitis, we talked about the meninges there earlier as something that can protect the brain from external forces. And it has three layers: the dura mater, the pia mater, and the arachnoid mater. These layers can become infected by either a bacteria or a virus, and when that happens, it's called meningitis. The second type then is encephalitis. So with encephalitis, it's the brain itself that becomes infected. And there's several common viruses that can cause that type of infection, including the herpes simplex virus, the chickenpox virus, and more recently the SARS-CoV-2, known as COVID-19, can also infect people's brains in rare cases. An additional source of acquired brain injury that we would often see is anoxia, and anoxia simply means lack of oxygen. It's a common cause of brain injury, and it occurs usually in the context of people having heart attacks, where the blood flow throughout your body stops, the brain becomes starved of oxygen, and that can result in the onset of brain damage after about 3 minutes of the heart attack. So the final group of people with acquired brain injury that I want to talk about are people who've had brain cancers or tumours. In situations where cancers go into somebody's brain, they can cause damage in a number of ways. The first way is that the tumour can directly or damage the surrounding tissue and effectively eat into them. And the second way is that sometimes tumours may not directly eat the surrounding tissue, but as they grow, and because the skull is a confined space, as the tumour grows, it causes pressure and it can damage the surrounding healthy brain tissue. And unfortunately, the very necessary medical treatment for cancer can also in itself sometimes cause additional sources of damage. So there may be damage by the surgeon going in to take the tumour out, and also some forms of radiotherapy and some forms of chemotherapy can also cause a degree of damage to the healthy brain cells that are there. And of course, this is in the greater good of treating the cancer and prolonging the person's life and increasing their quality of life. So those would be the main areas in terms of acquired brain injury that for people that we would see. So that would be traumatic brain injury, CVA or stroke, encephalitis and meningitis, anoxia and brain tumours.